I said in the last video that I had a couple of more things that I still wanted to mention here. So somebody who goes through rapid cycling experiences 4 of these cycles per year. So if you think about that, that would be about 3 months per cycle. So that's very different than the way that a lot of times people will casually use the term bipolar to reference mood swings, right? If somebody is super depressed one day and in a super happy mood a couple of days later, that's not bipolar, right? That's moving too fast. That's somebody with mood swings. That's something we can talk about with some other issues. But these slopes actually move pretty slowly. And there's a couple problems in how I drew this, right? Because they don't shoot straight down and straight up like this. They often go at a much more gradual slope, which there are some implications to that. And I'll get back to that in just a minute. Another thing that's not totally accurate about how I drew this is I drew them pretty evenly with bipolar 1, bipolar 2, and cyclothymia in terms of the time spent in mania or hypomania in comparison to the time spent in depression. And that's not what we typically see. Oftentimes, based on long-term surveys of people who have mood disorders, who have bipolar mood disorders, what we'll see is that the overall amount of time spent in depressive episodes or dysthymic episodes is about 35 times longer than the amount of time spent in manic or hypomanic episodes. So the majority of time is spent within those depressive episodes compared to the manic or hypomanic episodes. Now, why those smaller slopes are important rather than this rapid shooting up and down. The first thing has to do with what we talked about earlier about not having a very good measurement of time for how long the typical hypomanic episode lasts. Because if you think about it, if you're coming out of a depressive episode slowly and you overshoot what would be baseline mood and go into a hypomanic episode, to you, that's going to feel like, oh, wow, I feel really good. I have my energy back. I'm not needing to sleep a lot. I am motivated to go for a run and go paint my kitchen and plan a party. And you're moving so slowly, it just feels like, okay, I'm getting better. And it's not until that episode is lasting longer and there can be some engagement and maybe some risk behaviors or some self-destructive behaviors that people start to realize, oh, wait, I went too far. And thinking back on it, it can be hard to figure out where was that line between I started feeling good again and I went into a hypomanic episode. Because again, it's sloping up slowly. So it can be hard for people to be able to pinpoint when it was that happened. The other thing with this rapid shooting up, a lot of times we see this happen in a rapid fashion like this. If you have bipolar 1 or 2 that is misdiagnosed as depression, because people most often seek treatment when they're down here. If someone is down here and seeking treatment, what's the logical first course of action going to be? Prescribe them an antidepressant. Unfortunately, what happens a lot of times is if you prescribe somebody who has bipolar 1 or 2 or cyclothymia with an antidepressant, you are going to rapidly shoot them up into a manic state. And that rapid elevation of mood, unfortunately, is where we oftentimes see suicide attempts occur for bipolar patients. Because there's this idea of yesterday, I felt horrible, lowest of the low. I shouldn't be alive. I wish I was dead. Today, I have all this nervous energy. And you know what? I would have the energy to plan that and do that. And I don't mean to sound like overly cynical or dark in the way that I say that, but that a lot of times is how the thought process works when you have that rapid shot from a major depressive state into a manic or a hypomanic state, which is one of the dangers of seeing a patient present with depression and just automatically going to an antidepressant without evaluating if they have a history of behaviors that could classify as manic or hypomanic.